So how to properly feed the patient who are lying in the bed so that such condition does not arise?
Right. That's a very common issue, especially patients who are bedbound, patients who have stroke, patients who are frail. It's very difficult to move them, and and many times, I'm not saying families make a mistake, but I would say it's often a practice that is across, because they're concerned, they're worried that they don't want to move the patient and bother the patient, so they try to feed the patient in the flat positions. When you feed the patient, the food doesn't go down because the food has to move on under gravity, so it has to move down. So when the patient is lying down flat, the food tends to accumulate in the throat, and then the patient either might have gurgling sound or cough, or it might trickle into the lung. How do we prevent it? So the best way to prevent it is, as I mentioned to you earlier, keep her in a semi-reclined position. Keep her in either, if not 90 degrees, at least at 45 degrees inclination. Ensure that once she is fed, at least pat her back so the food goes down. Ensure that you keep her in that upright position for at least 1 hour. 45 minutes to 1 hour post feed, so that the food trickles down, because when you're feeding, the food is still in the stomach and that might regurgitate. So when you allow the food to gravitate, it will go down, it can never come up.